Welcome to our online event. It's called Recovery and Restart, How Community Transport Can Lead in Building a Stronger Community. We have something like 300 people signed up to take part today, and we've been joined by about getting on for 200 already, so welcome everybody. If you've ever been to a conference for a few hundred people, then you'll know it's probably not a wise idea to have them all on the stage at once. And if we tried that here, we'd probably break the internet. So today is going to be like an online version of a panel discussion at a conference. So there'll be time for asking questions and making comments. But unlike a conference, you are actually encouraged to chat during the talks using the chat function. Some of my CTA colleagues will be in there to join in the discussions with you. I'm being assisted in moving between speakers by colleagues, so please bear with us when we're switching around, which only take a few seconds. Thanks to everyone who's submitted questions. We're going to try our best to find you so you can pop up and ask your own question. And we'll also be checking the Q&A box for those that get submitted during the event. There'll be other events like this in the coming months as well. So if you don't get a chance today, then there'll be other opportunities. We know it's been a tough few months for a lot of people, and our thoughts are with all those across our movement, passengers, staff, volunteers, family members, who've all been struck by this terrible disease. And we offer our condolences to all those who've lost people close to them. In terms of who's here today, our audience is a mix of community transport charities of different shapes and sizes, or in different types of services, local authorities, other charities, not-for-profits that use minibuses, such as youth groups, churches, schools. And we've got participants from England, Scotland, Wales and Northern Ireland. Welcome to all of you. Community transport has played a vital role during the pandemic, and you deserve to stay in good shape for reconnecting our communities. You know your work is as much about community as it is about transport, providing companionship, social interaction, health and well-being benefits, both physical and mental. This has never been more prevalent than during lockdown, where you've stepped up to provide community as well as transport. You've shown how you can rapidly and radically refocus your work to deal with a complex and fast-changing situation, to keep people connected, and being there to provide essential journeys that still needed making, delivering food and shopping, collecting prescriptions, taking people to and from hospital, providing journeys for key workers, frequent telephone contact, all while showing a duty of care for your volunteers and staff, which has meant some services have not been able to continue. Despite the knocks to your finances and services, your care, your passion, your tenacity and resourcefulness have all shone through. All the best efforts in responding to this crisis have been local and communal. Community organisations, local authorities and local businesses working in partnership to get things done. And as restrictions are lifted, which will look different in different places, community transport is going to have a huge role to play in helping people to come out of lockdown in a safe and caring way, which will help our communities recover as well as the economy. So whilst our absolute focus at this moment is on recovering and restarting, we should ask, should we stop there? Can we free up a little bit of our collective brains to reimagine how transport can be changed so it works better for more people and protects our planet? What lessons do the last 4 months create for the future of passenger transport, and how we can build back better with a stronger role for community organisations in shaping and running local services? How do we fix some of the problems that were there before and haven't gone away? Scarce and short-term funding. We're still waiting for UK government guidance on how to demonstrate you're operating for non-commercial purposes, and still seeing challenges on driver training requirements. But we know that enabling better and more sustainable transport for all requires a strong sense of community, a strong sense of place, and a commitment to collaboration. And that's what you've shown during lockdown. And these are the essential ingredients if we want to build back better, and they're in our sector's DNA and should be at the foundations of any modern integrated transport network that can meet more needs. So I'm going to introduce our speakers. The first person, we're still waiting for Matt Rodder. So the first person I'm going to introduce is my colleague, Suzanne Lau. Suzanne's been doing some work over the lockdown to look at the financial impact on CTs and to try and really get beneath what's happening and to see how it's affecting different organisations. So Suzanne, would you like to start your presentation. Suzanne's used a PowerPoint, so it'll take a second to get that up. Over to you, Suzanne.
Thanks, Bill. So, hi everyone, I'm Suzanne. I work as a policy executive for CTA, and I'm just going to be sharing a short presentation with you about the financial impacts that the community transport sector has faced during this time. So, as we all know, the UK officially entered into lockdown on the 23rd of March, and this has meant suspending all but the most essential journeys, and obviously core services and activities have reduced dramatically over this period. But it's been really, really heartening to see that a lot of CT organisations are meeting needs in new ways. So, for example, delivering food and medicine, speaking to members on the phone, and also still meeting transport to vital health appointments. And as the lockdown period has lengthened, we really wanted to understand how these changes to services have been impacting on the sector financially. And as a result, I spoke to members across the UK to just gain a bit of a better understanding of these financial challenges. And I just want to say a massive thank you to all of the organisations who have taken the time to speak to me over this period. And just to give you a general sense of the spread of the organisations, I provide a little map there. And our learning so far has shown that broadly, members' responses have fallen into three key phases. So phase one covers the initial period where services have suddenly reduced and where CTs have been meeting needs in new ways. And as the lockdown's lengthened, we have entered into phase two where CTs are starting to feel some of the immediate financial impact, and phase three covers some of the long-term impacts that organisations are going to start facing as we emerge from the lockdown period and as restrictions ease. So this presentation is going to be covering some of the general trends that the sector's faced, and it's going to be covering some of the immediate impacts, and it's also going to be covering some of the longer term impacts that organisations are already starting to feel. And then I'll cover some of the more local specific factors which have really shaped how organisations have experienced the past few weeks. So in terms of immediate impacts, there have been two key impacts on organisations. So firstly, core activities and services have dramatically reduced, contract payments have stopped or reduced by 30% or more, and self-generated income, that's income that organisations have generated independently from external funders, so basically through fares and payments for group hire services, those have significantly reduced or stopped altogether. And the second key impact has been that staff, particularly volunteers, have had to shield, and that's led to significantly reduced capacity in organisations. But organisations have also been able to offset some of these financial impacts by relying on some cost savings. And in general, these include the furlough scheme, obtaining grants, speaking to landlords, vehicle financiers and insurers to reduce some overhead costs, and also using some reserves. However, the ability for organisations to balance these income losses with cost savings begins to tip slightly as we emerge from the lockdown. So in other words, looking ahead, community transport organisations are likely to start incurring costs before they actually start to see a parallel increase in income. So just to quickly move through some of the long-term impacts, ongoing social distancing will mean that there's going to be increased operational costs because vehicle capacity is going to reduce quite significantly. This is especially important because of the nature of the passengers that CTs transport, i.e. older, more vulnerable people at a higher risk of contracting the virus. So for organisations who charge for their services in arrears, there also is likely to be a bit of a cash flow issue, essentially where organisations are incurring running costs before receiving any payments for running those services. We'll also, unfortunately, likely see a reduction in the availability of grant funds, and reserves will gradually be depleted, which will have an impact on an organisation's long-term sustainability, because often these are monies that were reserved for costs such as fleet replacement. So this is leaving many organisations in quite a financially precarious situation. But how far these organisations have been able to sort of weather the storm, so to speak, hasn't actually been about the services that they run, but actually about local specific factors. So these I've identified as local authority support, reliance on group hire income, relationship with the health sector, and finally the degree of deprivation in the operating area. So to demonstrate some of these and to bring this to life a little bit, I'll be running through a few case studies, but just in the interest of time, I'll cover just the two main factors which I would say are local authority support and reliance on group higher income. So in terms of local authority support, I'll run through two key examples. So the first is Organisation A. This organisation operates in Wales. They have 14 vehicles, 11 paid staff and 15 volunteers. Like many others, Organisation A have diversified their services to meet new needs by delivering meals, medicines and telephone support to those who are shielding. And throughout this period, they've been really lucky to benefit from really a supportive local authority who have continued their usual funding. They've also provided additional funding to cover some of the costs of their food delivery service and to cover some of their ongoing running costs. And on top of this, this local authority have also provided the opportunity to diversify their service by offering school contracts that Organisation A have historically been unable to run, but now will have the capacity to. So the outcome of this is positive. This local authority support has meant that Organisation A are able to keep on top of their ongoing running costs and rely on new opportunities to make up for some of the lost income. It's been really positive from all the conversations that I've been having with community transport organisations so far to hear that actually this is a general pattern across the UK. There's been a lot of very supportive local authorities who have helped the community transport sector during this time. However, there have been a few examples where this has not necessarily been what's been happening. So I'm going to move on to Organisation B. Organisation B operate in London. They have 28 vehicles and 50 staff. They've similarly diversified some of their services like Organisation A, but unfortunately their local authority have been highly unsupportive. So Organisation B runs services through contracts for 2 local councils in London, and they also run some for some community groups. However, despite the Department for Transport's recommendation that local authorities continue to honour contract payments at 100%, local authority A have only paid for 20% of this contract payment over the period of April and May and have since stopped payments altogether. And local authority B have stopped payments from March onwards. And despite this, their local authority actually own their premises and they're still expecting Organisation B to pay their rent. To add insult to injury, Organisation B haven't actually been able to rely on the small businesses rate relief because their rent is rates inclusive, and they're still having to incur the costs of running some of the services that the local authority have commissioned. This is potentially a case of a frustrated contract. And this is on top of the group higher income that they have lost during this period. This means, unfortunately, that the outcomes for Organisation B differ significantly to that of Organisation A, and instead Organisation B are having to rely heavily on reserves, which they envisage will run out by as early as September. They're also facing a shortfall in income of around £10,000 per month, and as a result, they're likely to have to sell some of their assets, like vehicles, and make some redundancies to sustain their organisation. So in terms of reliance on group higher income, we have Organisation C. Organisation C operate in Scotland. They have 15 minibuses and 19 staff. They're specialists in group hire transport, and they deliver services both individually and as part of 2 local authority partnerships. So the annual income can be broken down as one partnership worth £151,000, another worth £71,000, and also on top of this, £192,000 of group hire income, or that can be also broken down into £16,000 per month. So as you can see from that breakdown, their self-generated group hire income constitutes almost half of this organisation's total annual income. Like Organisation A, Organisation C have positive relations with their local authority, and they've received confirmation that the £71,000 partnership funding is going to continue, and they're in communications to clarify the status of the £151,000 partnership. Unfortunately, they don't have any way of compensating for their lost group hire income, meaning that they're actually currently facing a £16,000 monthly shortfall. And to make up for this, they're hoping to set up some more food delivery projects together with some of their existing partners, but that's only going to recover a predicted quarter to a third of their shortfall, meaning that they'll still be facing a significant reduction in income. So as group hire services rely on payments from other community groups, the degree to which these services will return for Organisation C and other organisations who also run similar group hire services is that this will depend on whether these organisations will be able to survive financially themselves, whether they'll be able to foot the increased operational costs, and whether or not they will choose to continue running these group hire services. So just to give an example of that, we're hearing about Age UK branches who are closing down. We're also, if these groups like Age UK branches do survive, they may actually choose not to foot the running costs of running 2 vehicles instead of 1, or they may just choose not to run those trips altogether. So to sustain that organisation in the meantime, Organisation C will be relying on reserves, which they envisage will sustain their organisation for a maximum of 1 year, after which the future will be uncertain, and they're also going to face the prospects of having to sell their assets and make redundancies to reduce costs and sustain their organisation. So like Organisation A, Organisation B have been very well supported by their local authority, but because of their reliance on group hire income, they face some very different outcomes. So I've run through those all really quickly, and obviously I've not been able to cover a lot of the other factors that have determined how organisations have been able to survive through this period, and some of the factors that have affected their experience during this time. So if anyone wants to discuss any of these things further, please do feel free to drop me an email on suzanne@ctauk.org. Sorry if you're hearing a voice, that's the postman. So that's all from me.
Very much for that, Suzanne. I think that was, as Suzanne said, a whistle-stop tour through some of the big issues, and we'll be able to share that. I know some of you asked in the chat, will we be able to share these? Yes, we will. And actually, there's probably some more information behind all that we can also share, as Suzanne has said. And I want to reassure everyone, this isn't simply an academic exercise for CTA. In making the case for funding, this kind of, for the sector, and being quite active in that, this kind of information is crucial, because we need to be able to quantify the nature and size of the problem, what it's going to cost to fix it, and also what the extra costs are going to be down the line to the public purse if you're not helping people to stay independent and have a good life. And stuff like that, which Suzanne has shared, is exactly what we need. So keep it coming. Never be shy of sending us information that really lets us know what the impacts are being, and helps us understand and get beneath the kind of headlines on that. We have seen some extra funding for the sector, not a great deal. We estimate there's about £500,000 come from lottery and foundations from some of the research we've been doing. Some of the extra funding that's been given by Department of Transport for buses that's given to local authorities, some of that may have found its way to CTs, but actually we want to see more of that, and specifically ring-fenced for community transport. And obviously there's other initiatives in Wales, Scotland, Northern Ireland, and their conversations we're having too. I've been talking to NHS England. I think there's a real opportunity, and we've seen the extra work we've been doing with the health service. Our profile's never been higher. And I think what we now need to see is more formal relationships, because actually the health sector benefits massively from the work of community transport, but doesn't always pay its way. So we want to see that changed as well. We're looking at how we can get organisations providing trips in the health and social care sector, and get those that do it already to switch to enabling local CTs to do it instead. And we're getting ready to do some of the heavy lifting on that with you, and broken those relationships. We're also working with an organisation called Social Finance to develop some project ideas that will be fundable, and make sure that resources find their way to local communities to help organise your community transport. And I think also, because things like traditional on-street event fundraising, some of the things you may have done to fundraise in the past. They've all but stopped. We're setting up some workshops to develop the sector's work in digital fundraising for those that want to give that a try. So that's just some of the things we're doing on that. We can talk a bit more about those things later. I'm going to go to our next speaker now. I understand we're still working with Matt Rodder to get him online. So I'm going to ask John Taylor to join us. John is a director at the TAS Partnership. He's a great friend to CTA and community transport. And we're delighted John's able to join us today to share his thoughts on recovery and what that means, what we should be looking at for the future. A lot of the support and guidance we've been able to offer members has been developed with John and the team at TAS over the last few months. We really appreciate their experience and expertise in helping us and you stay a step ahead of the issues. As I said earlier, it's been a complex and fast changing environment. So welcome, John. Over to you.
Thanks. Good morning, everybody. It's at this point that I normally say, can people hear me at the back? But I can sort of difficulty with not being able to see anybody at the moment. What I want to talk about in the 10 minutes I've got is broken up into two parts. Firstly, just some few thoughts on the recovery aspects of community transport, and then thinking about restart and new start issues. Certainly a few of these that have been going through my mind in the last couple of months. And what I'm going to say is based on the work that the TAS Partnership has been doing during the pandemic, along with our sort of long-standing experience of the CT sector, as well as my own personal experience. I'm a trustee of Preston Community Transport, although I'm not speaking on their behalf. It's really my observations of the experience in Preston and indeed with other CT projects in the locality in Lancashire. And I was interested, I'll just say this before going straight in, with Suzanne's organisation B and the experience in London. And I do wonder whether there's a differential between those CTs which are operating in passenger transport authorities and those CTs that are operating in London boroughs or metropolitan districts, and which don't have a sort of funding relationship, and that's a particular issue in London with the Passenger Transport Authority, because the passenger transport authorities have had a very clear steer about continuing to support their local bus operations. And I think our observation is, in general terms, they've applied the same approach to the community transports that they've been supporting. And obviously that won't be the case in district or borough councils, which aren't unitary authorities. So, going into the core of what I want to say on the recovery aspect, there's a lot of advice already out there that we've been working on, and obviously incredible amount of detailed questions that come in, and sufficient to say, hopefully, that we will continue to try and answer as many of these as possible. And I'm assuming that many CTs have already started to recover at least some proportion of their service patterns. So they're restarting dial-a-ride or shopping bus or car scheme operations. But obviously this depends on the enthusiasm of their passengers to actually want to come out and travel. So I've got just three areas that I want to talk about. And the first one is communications. And I don't want to cross over what Sarah's going to talk about later, but that has been an absolutely critical issue for Preston CT, but also what we've observed with other community transports that we work with. This is a perfect moment to go back through your customer relationship management system, if indeed you have one that is called a CRM. But basically, how up to date is your contact information? How up to date is your membership information? What do you actually know about your membership? How regularly are you talking to them? How regularly are you doing some formal and informal surveys? What research are you doing with them, and so on? And clearly, this is requiring continued communication, and there's a mix of direct telephoning, which has been going on through the membership lists to ensure that you are reassured that your users are in good fettle, and that if they actually have anything that they need, they can't get at, that you are able to think about providing it or signpost to whoever can provide it. Coming at this from a, the answer is yes, what's the question point of view, which is the general role of community transport. It's how we got into running transport in the first place. Communication with staff has also been critical, including the volunteers as well as employees. Many of them will have been shielding, and you may have lost volunteers who can't take the particular risks that they perceive. Equally, you may have come across new volunteers. Certainly our experience has been that the big push for NHS volunteers has not been matched actually by any means of giving them work, and a number of those have ended up in our direction. So the issue for us now is, can we actually keep hold of them and ensure that they are rewarded and feel active and that this is positive. And then communication with funders. Obviously, repurposing your functions. What do they know about it? How are they going to benefit from any PR that's associated with you? What resources have you got which would have been paid for under contracts? How are you reusing them? What can they do with them? Are you making those available to their resilience operation? Do you acknowledge them in publicity? Are you indeed helping them with planning? Certainly my experience has been that a number of authorities have had themselves some difficulty in thinking through the logistics, thinking through the technical issues to do with passenger transport, and actually have benefited from the professional approach that community transport groups have been able to offer them. So that's on the communications issue. Just covering the many technical questions that come in. Obviously, I can't go through all of them. I want to say something just general about risk. And to remind everybody that we are not trying to eliminate the possibility of infection. There are too many imponderables in this. There is always some level of risk. Our task is to manage this and to be seen to manage it. And I just remind everybody that there's, there's a nice word, reasonability, reasonable measures, reasonable response, and keeping up to date with the latest techniques, the latest approaches, guidance, and so on. It constitutes a reasonable response. You're not expected to do everything absolutely perfectly to 100% because it cannot actually be done. So we have the sort of practical issues that you just can't avoid: breaching social distancing and physical contact in some cases if your wheelchair users are going to be coming back onto the vehicle and travelling. So you need to ensure that everybody understands this and they are happy to participate given the particular precautions that you've taken, and that you've undertaken training and role play for the volunteers and staff beforehand. The actual level of risk is a combination of so many different factors that the levels of infection in the locality, the lifestyle and behaviour of staff and your passengers. We're not anticipating that our passengers are actually going out clubbing. In our local area, there aren't that many sort of large family groups who've been meeting together, but certainly in other parts of Lancashire, that's an issue at the moment that we need to take into account. So there's inherent individual risks about age and health, how close people get together, how long they're close together, what physical precautions you're taking in terms of screens and sanitisation and so on and so forth. It will be down to your particular circumstances to identify the appropriate mix and what's appropriate. Certainly in our local CT, we were not expecting the demand to grow for the services as rapidly as it has done. So we're already back up to 70 or 80% of the patronage potential. And obviously there's more products and techniques coming out, so it's a question of watching the CTA website and keeping up with the guidance that's coming out, and we will attempt to keep it up to date as far as possible. So that's the communications, then the technical issues. I just want to say something very briefly about one aspect of PR, which is that we've had obviously a lot of deaths already in the UK, and there are concerns about what's going to be happening from now on, and particularly across winter. And therefore you do have to be prepared for one of your users to be infected and indeed a user to die. And similarly with a driver, paid staff or volunteer in the same way. So I just want to cover that particular area, that you need to have a plan in place. Who is actually going to lead the response, the management team, trustees and so on, and how are you going to respond to the various individuals, the press, the relatives, the press, funders, the local authorities involved, union staff representatives and so on. We've had to assist one particular community transport with ploughing through this, and it is a particularly stressful moment. So forewarned is forearmed, and hopefully this is like insurance that you pay for, you invest in, but it doesn't actually end up being needed. I want to say something briefly now on aspects of restart. And I think the things that I want to talk about is review, something about and then something about the context that we're working in. Firstly, this is the perfect time to review what it is you're there for. Who is it that is disadvantaged in your area in respect of mobility? How are they disadvantaged? You will have the opportunity to re-engage with local authorities, planners, the NHS, funders and so on. And I think the simple message is challenge your status quo. the status quo is no longer going to be acceptable, because normal, what happens now is not going to look like what has happened in the past. Don't assume that the solution has to be transport. We've already experienced that during the pandemic. If your, for instance, core objective is the quality of life of older people in your area, then providing transport is not necessarily the only way of delivering that and improving that. So you will potentially be continuing to do shopping delivery even after people are coming back onto dial-a-ride and shopping bus services. You may continue the personal support function with regular welfare phone calls and so on. You obviously need to network and liaise with other agencies in the field to identify the particular niche that community transport can play. Turning to context, thinking about three major themes: transport, climate change, and the inevitable recession that we're going to be facing. There's a huge debate going on right now as to future patterns of transport generally and passenger transport in particular. How on earth do we know? Can we forecast how this is going to pan out? What is community transport's role in this, and how are you participating in the debate locally? Do we in fact have any leverage, and how can we create the leverage for ourselves? For example, there's a lot of current emphasis on cycling and walking, but at last count, cycling constituted about 0.6% of journeys. So even a huge amount of increase proportionately in cycling is not going to have a major impact. There have been implications of the shift to walking and cycling more, particularly in urban areas, in terms of the infrastructure in towns. And our experience has been that this has been done in a hurry, and it's had negative impacts on access in those locations. So pedestrian access in some cases has worsened, certainly bus access has worsened. And so part of what I'm thinking about here is what community transport's role is to try and intervene in the process that's going on to ensure that our passengers are not disadvantaged in the way that changes are being introduced. But secondly, what is the community transport function as regards reducing car use and cleaner air in our localities, less congestion and so on? I simply float the idea that you will have seen the e-scooters trial just starting up. Use of e-scooters is only going to be legal if they are hired. So hiring involves getting some capital together and then breaking it into small affordable chunks and pushing it out there into the market, along with the provision of safety gear and training implications. This sounds to me like community transport. That's what we do with minibuses. We buy them in bulk and then make them available in small affordable chunks. We handle hiring arrangements and so on, and we have safety training and so on. So do we actually have a role in this sort of arrangement? A second issue, I suppose, is about e-bicycles associated with this, particularly helpful to some of our passenger demographic. They really do make a significant impact on older people's ability to keep cycling. What are we doing locally on that? But both a lot of the micro-mobility that is being introduced is extremely unsympathetic to those who have accessibility and mobility difficulties. So can we do anything to counter that? Are we making available some of the new mobility technology that is slightly more friendly? Wheelchair accessible bikes, for example. through us to ensure that that group of passengers is not missed out in this change. The second big issue around transport at the moment is obviously the decline in bus patronage. The government's been giving lots of helpful messages about how dangerous travel collectively is, and that we should all sort of avoid travelling at all, and certainly avoid getting on buses and trains. This obviously knocks on to community transport and the perception of travelling together in minibuses, but it's having a major impact on the economics of bus operation. And even quite small declines in conventional bus patronage in rural areas is going to mean the loss of bus services. So we have to think about beefing up our approach in rural areas in particular, and how we're going to do that. And Bill mentioned earlier the sort of work that social finance is doing, and it'll be interesting to see whether that helps with that particular challenge. Moving on to climate change, just generally, CTs as exemplars in this. I'm just conscious at the moment of the Confederation of Passenger Transport's proposals for massive introduction of electric or other zero emission buses, particularly through a large scale leasing problem to get over the initial capital costs of introduction. And I'm thinking we actually need exactly the same in the community transport sector to enable CT groups to be much more active as sort of climate change champions in terms of passenger transport and looking for zero emission. And obviously some of this will relate back to whether you're in an urban area which is about to introduce clean air zone with associated restrictions. And then my final thoughts are around recession. Actually, I started a long time ago in community transport at a time of significant unemployment and recession. And I can anticipate that we are going to see a whole collection of job creation initiatives and support. And community transport actually played a major role going back to the 1970s and 80s. We were one of the most effective set of third sector organisations to create long-term work out of the temporary employment schemes. So this raises a whole load of issues for the community transport sector about our role within a recession economy and supporting job creation and supporting people who can no longer afford the personal mobility that they've previously had. Within that, there are obviously issues about town centres and the whole change to the retail environment and what our role is, those of us who operate in urban areas, in terms of supporting the changed use of town centres and making them still sustainable. And I note that, you know, the hospitality industry is desperate for business at the moment, and how much work we're actually doing with them on a bilateral arrangement to try to see if we can organise transport that will enable them to continue their businesses. So that's a quick canter through a series of thoughts that I've been contemplating over the last month or so. Clearly, uncertain times that we're in at the moment create the opportunities to do things differently and renew ourselves and renew our reason for action, and how enthusiastic we are, why we really want to put energy into this. I do see that the community transport sector has a significant role as leaders. So I commend that idea to you. Thank you.
Well, thank you, John. That was covered so much ground there. It was amazing. Thank you. Right. I'm just going to go quickly on to our next speaker, and then there'll be some time for questions. I've had an update. unfortunately, Matt Rodder has got technical issues, so can't speak, but he's watching and he's enjoying it, and he's giving us loads of ideas and stuff. So there will be some follow-up there. Don't worry about that. One of the things I kind of said in a news article recently was that our sector had been more interested in providing lifelines than making headlines over the lockdown. To reflect on that, we weren't really making the news, but that doesn't mean there wasn't some absolutely marvellous stuff going on. We have seen some, good articles and interest. We can always find more. And one thing I wanted to do was invite Sara Robinson along today. Sara's working with us in Wales and with CTA members on our Connecting Community in Wales project. And I think some insights into how we can tell our story better and actually do some of that thing John says about elevating ourselves into conversations that are taking place often without us, and how we can base that on, practical things that you can do yourselves. So without further ado, over to you, Sara.
Good morning, everybody. As Bill said, I'm a public relations consultant, and I've been working really closely with the fantastic team in Wales over the last few months to help that team communicate their successes and stories to the Welsh public, but also to decision makers and influencers. And along the way, we've learned what works well, and I've been working really closely with some members in Wales as well as part of that public relations outreach work. So hello to everybody on the webinar today that I've been working with as part of that. Quite honestly, it's been an absolute privilege and pleasure to help tell the stories of the impact of members' work here in Wales, as well as the wider story around the importance of community transport to tackling social issues such as loneliness, social isolation, physical and mental well-being, and many others. So I'm just going to start screen share, if you bear with me 1 second, to show you an example of the type of headlines that we've been kind of generating here in Wales. You can see a thought leadership piece authored by Christine Boston, the Director for Wales and the UK Lead for Research and Policy. And this was a piece in our national daily newspaper looking at how the community transport heroes in Wales were rising to the coronavirus challenge. We felt it was really important to tell this story as it was happening, because it would be so easy, as Bill said, to kind of for that to get lost in the kind of strange times that we've been living through recently. So I'm here today to talk about the importance of storytelling in being part of the building back better conversations. And the first thing to note there really is that building back better conversation is a wide-ranging conversation covering so many different areas of life, the economy and public policy. It's a crowded space. So it's really important that as a movement, you need clear messages at a local level and at national level as well, communicated consistently in order to cut through and kind of earn yourself a kind of voice in that conversation. My second point is that human stories are the stories that resonate the most. So for me, there's a lot of work to be done in kind of creating those stories. But the good news is that these stories already exist. They exist in all the work you do every day, the amazing work many of you have been doing during this crisis and the work you plan and hope to do in the future. Your challenge really is how you tell and present those stories. And I suppose the good message or the positive message that I'd like you to take away today is that you don't need necessarily a PR consultant or any professional help to do this. You can absolutely do this yourself. You need a process, and you just need to consider some kind of key points really. So first of all, how do you articulate your stories? So we know that every single CTA member will have brilliant stories. You'll have stories about how you change lives. You'll have stories about how you improve communities, how you tackle all of the issues that I mentioned above. And the thing to remember really is that in any good story, this just comes down to the basic psychological principles of storytelling, which as human beings we've been doing since we sat around campfires. So this is a kind of really important thing to remember, that emotional touch points are crucial to storytelling. It's important to think about how you want people to feel as a result of your story as much as what you want them to know. And that's the mistake people make sometimes. They get bogged down in kind of jargon, they get bogged down in kind of using charity terms like impact, which are all well and good and they're fine and they have their place in annual reports and reports to funders and that kind of thing. But in terms of raising the profile of the work that you do and being part of that ongoing Building Back Better conversation, it's really important that in your storytelling you explain how you change lives, but you show, not just tell. And a part of that is about using plain English. It's about using, the kind of very human emotions in your stories, avoiding jargon. As I mentioned, jargon can be a real switch off. And then use if you bear in mind that your users and your volunteers are your biggest asset and your biggest ambassadors, so use them. So using case studies and direct quotes are really powerful techniques for storytelling. And also think about using various mediums, so not just the written word. Think about how you can use video and images to bring your story to life. And the good news is you can do this stuff yourself, because smartphones are fantastic these days for taking great images, for shooting video content, so you can do this stuff relatively quickly and very, very cheaply. So in terms of getting your stories out to the world, once you've developed your stories, then really the next step is about identifying the channels for getting those stories out there. So number one on my list here is using local media and hyper-local bloggers. So obviously that can be a really powerful way of kind of raising awareness of the work that you're doing. And when it comes to working with the press, you don't need a specialist to do this for you. You just need to ensure that you're producing or that you're generating well-written stories. You don't even necessarily need to write them yourself, but it's always helpful to have a synopsis that you can send to the press. And in terms of finding out who to speak to, so don't be put off if you don't have a contact, because a simple Google search can help you find contact details. Many journalists are on social media, most news outlets are on social media, so that's another way that you can use to reach to them and also to pitch your idea or story to them as well. Social media is another fantastic way of increasing your reach. Obviously, this will depend on the kind of demographic of your users, but remember the people that you're trying to reach to be part of these conversations will be kind of local decision makers and politicians and at a higher level as well. So social media can be a really powerful channel for that. Things like Twitter and Facebook can work really well. So think about what channels you have for your project or group at the moment. And if you don't have any channels set up, that's fine, because you can tap into the channels that people in your local community have, or groups in your local community have. So there will be existing social media groups and channels in your local community that you could try to tap into. So that's just about reaching out to people and kind of asking them if they are willing to share your content and help get it visible. And when it comes down to this, it can be a little bit scary. It can be scary if you've never done this before. It's quite time intensive sometimes. So my advice here is really harness the skills and the networks of your volunteers and members. So try and identify somebody in your team that kind of has a passion for this or a propensity for it, who's particularly good at using Twitter or Facebook, and perhaps ask them for some advice or to take a lead on this area as well. And another area I wanted to cover was reaching elected representatives. So obviously a big part of being part of these conversations is about ensuring that the people that represent your local community are aware of the work that you're doing and are aware of the impact of that work and why it matters. So there are different methods that you could use to do this. I know that Matt's on the call, so I'm hoping that he would agree here. But the thing to remember here is that elected representatives are time poor. And what they need to know is how you can how you do make their constituents' lives easier, and what wider kind of social problems you help to solve. And that's really your job. Is elected representatives don't want to wade through huge reports. It's about making that information digestible so you can easily demonstrate to them why your work matters. So things like when it comes to MPs and also members of the Senedd here in Wales, MSPs in Scotland, MLAs in Northern Ireland, things like letters and and local councillors as well, of course. Things like letters and briefing packs can work really well. As I said, make sure that you format that in a way that makes it easy for elected representatives to understand your work and the impact of that work. obviously in kind of more normal times, I would recommend inviting your kind of key targets and your key political influencers to come and see your work in action. So for me, there's no better, when I talked about show, not tell earlier, there's no better opportunity to create that emotional connection with an elected representative than getting them to come and see your work in action. Obviously, that's not possible right now. So think about other ways you can demonstrate that the impact of that work. So another charity I work with in Wales, we're doing kind of care packages for the people that they work with. And what we did was get the volunteers just shooting video content. You know, there's a few simple tips here. So make sure that you're holding your phone landscape, not portrait. That works better in terms of editing and quality of the video, but can you use video to demonstrate your work, and can you get that in front of an elected representative? That's a really kind of good way of shortcutting the restrictions around physically getting them to come and see your work at the moment. So have a little think about that as well. And quite often when I speak to members and I speak to people who are perhaps not used to doing this type of work, that are recognising that they need to do this type of work, and actually it's a fundamental part of their future kind of sustainability, and making sure that there is that awareness of the importance of their work. The number one question I get asked is, this all sounds well and good, but how do we get started? You know, where do we even begin? Because we're not experts. And that's absolutely fine. You're not supposed to be experts on this, but you are experts on the work that you do, and that's the thing to remember. So step one is for me is around conducting an audit of the stories that you have, and an audit is probably, you know, just a fancy word of saying a fancy way of saying sit down and make a list. You know, who are those? I was just looking at the chat earlier, and there was a lovely anecdote about a lady who burst into tears when she found out that, you know, she was able to go on a mystery trip, and there was something to put in the calendar as opposed to crossing out everything on the calendar as we've done over the last few months. So, you know, those type of stories are gold dust. So make a list, decide what they are, map them out. And then decide what channels you will use to get them out there. So you might decide to focus on local media, or you might decide that getting in front of politicians is more of an important priority for you, whether that's a local councillor or your MP or anything in the middle, in the devolved administration. So have a think about what channels you want to use, and kind of that will help you plan where to kind of focus your resource and time. My other top tip as well is, don't try to spread this work over too many people. I'm very aware that many of you will be very small teams, you'll be very stretched, but if you can identify somebody in your team who has an interest in this area, who perhaps has some background, or you know, is just good at writing, or kind of good at storytelling, or is, you know, particularly good at kind of forming connections and relationships with people, then give responsibility for this to perhaps one or two people who can take a lead, because it tends to be more likely that things will get done if you kind of allocate the responsibility to somebody. And the other thing I wanted to say is that there are plenty of good resources available online to help you if you're stuck. So if you're looking for tips on anything from social media to putting a simple video together to writing a good press release, Google is your friend. There are hundreds and thousands of kind of articles and videos online to help you with this stuff. And so really the message I want to leave you with is that you can do this yourselves. You can undertake a little bit of work to raise the profile of the work that you're doing, to ensure that you're kind of on the table, that you're on the radar when it comes to being part of those building back better conversations. It does take time, and it does take resource, obviously. So identifying that is a key part of getting cracking with this work, really. But you don't need any kind of external help. You don't need somebody like me. The team in Wales, obviously, kind of, you know, I work with them, and that's fantastic. But that's because there's funding in place for that to be the case. But, you know, you can do this work yourself, is the message I want you to take away today, really. And also, you have, you know, I've only spoken to a handful of kind of members in Wales as part of everything that's been happening over the last few months, but during that process I have heard so many amazing stories, and I know that this is true across the membership. I know that this is true across the UK, and there is a wealth of incredible, inspiring stories there. So for me, it's just about identifying what they are and finding a way to get them out there. And so my last tip really is make a plan. and get cracking. That plan doesn't need to be necessarily, very complicated. Just make a plan, decide who's going to be taking a lead on this, allocate some time and resource to it. But the good news is the crux of what you need to do, for some organisations, the struggle is in finding the stories, and that's a really hard struggle to overcome. If you don't have them, you will have them. So this is about kind of identifying them, turning them into content, turning them into good, strong, consistent communication, and getting them out there and getting them in front of the right people. So that wraps up my presentation, and I'm happy to take questions at the end.
Thank you, Sara. Okay, we've got some amount of time for questions. If we can get everybody, or it'll be myself, and John and Sara back on the screen for all the participants to see. Now, what we're going to do is we've had a series of questions in. Some of them are kind of quite similar. So I'm going to try and start by getting one or two people up to ask their question. There's a significant theme around the age of 70 and that being a really important factor for organisations in considering whether to restart or not, given the age of many of your volunteers. So what I'm going to ask is, if I say your name and you want to actually come online and ask your question yourself, what I need you to do is press the raise hand button when I say your name, and then you'll pop to the top of my colleague's screen and they'll be able to open your mic for you. So Sue Lynch from Buckinghamshire, you asked a question around getting back up safely, given that some of your volunteers are age over 70. So Sue, if you can raise your hand if you're here and want to ask your question. Okay.
Yes, we're a very small organisation. You're obviously talking today about much bigger organisation, but we're just volunteers with no sort of profits or anything like that. But when we went into lockdown, most of my volunteers were over 70 anyway, and so many of them needing to shield and certainly not able to do. So we stopped doing transport altogether. Most of our transport was to medical appointments and hospital and GP appointments. And we haven't yet restarted because, and of course the volunteers are using their own vehicles, which will then be used by their family and friends possibly afterwards. And so I was concerned about, how we keep them safe, as well as obviously the clients that we're transporting.
Oh, I think we've lost.
Did you get that?
We lost the last bit, Sue.
You might have lost me. Have you got me? Well, I just really want to know how to keep my volunteers and clients safe, really, if we restart, when we restart.
Thank you. So, John, can you just quickly touch on that? Okay.
The first point I'd make is that I'm heading towards that magic age of 70 myself. So, I'm certainly not intending to, constrain my activities at that point. And actually, there's a cohort issue here about whether 70 is an appropriate threshold at any point. However, I do appreciate exactly where you're coming from, and certainly my own organisation has had exactly the same issue of volunteers needing to shield. Obviously, we have introduced guidance in terms of the cleansing of vehicles and wearing face masks, and we require this from our passengers. But also in terms of the volunteers, your point about who's using the vehicle and so on, I think we do need to have the discussion with volunteers about their lifestyle. It's not always an easy conversation, but it's actually needed, because actually if the volunteers do have control over, they're basically not going out a lot, and they don't have a whole load of other people using the vehicles, then it gives them much greater control about the minimal risk of infection involved. So I'm just saying that there are things that you can do which provide reassurance both to the volunteers and to the passengers. And then just in terms of balancing the risk, I'd make the point that not travelling has health risks associated with it. And they're quite significant health risks. At a direct level, we've seen nationally, and we've seen that locally, that there are people who have been too afraid to travel and therefore have been missing appointments for cancer and so on. And ultimately, this is a worse health outcome than the potential risk of COVID infection, given the precautions that we are actually taking. Plus, there's the general issue about, physical activity and, heart disease, and the whole issue about social isolation. So I think we actually have to be quite clear about wanting to enable people to move, but to manage this in as safe a way as we can manage, up to what I said at the very beginning, which is this a reasonable approach in the circumstances? And generally, the answer that I've seen is yes.
Great, thank you, John. Pat Kinniston from Ellesmere Port and Neston Community Transport, you've asked a question. If you want to come up and ask your own question, can you raise your hand now? This, John, is around, and Sara's around. There's one online about social distancing and they're not, and that being quite muddled. So
I should be there. Can you hear me, Bill?
Yes.
Okay.
Welcome.
It was two really, but the critical one for us is we're a very small organisation. We run predominantly volunteers, just 2 part-time members of staff. But we run a small school contract, which is commissioned by parents to take their youngsters to a school that's outside our usual school catchment area, and there's no public transport accessible. So traditionally we take between 14 and 24, depending on the age year, on 2 minibuses. Our break-even cost is, depending on where they're going and their rate, between 10 and 12 on the minibus. That's on a 16-seater, which is what we use. That would not allow for social distancing. But I talked to a general coach driver colleague of mine the other day, and he said that the local schools are now rebooking their September contracts on 70-seater double-deckers for 70 pupils. So is there any guideline? Is that an assumption? Because if we can't get minimum 10 on our minibuses, that's not viable for us financially. The parents won't pay an increase and those kids will not get to school.
I don't know, so someone else has asked, it's Rich Allen from Sidmouth, about asking donations. So I think wrap into that, please, John. To what extent can we pass on some of these extra charges to, his example was for cleaning instead of a donation. To what extent can, one of the dilemmas here is the extent that we can pass on some of those extra costs to the users.
Yeah.
Again, can you try and get it into a minute or so we can have another couple of questions as well?
Right.
Cheers.
The school transport position is super complex and it's changing by the minute. There's been an assumption that, certainly recently, that even if they start the schools up, not everybody is actually going to turn up. And particularly those people who are entitled to transport, many of them will actually be travelling with their parents. So although one may in principle say we're going to have 70 children on a 70-seater, the actual anticipation is that that isn't going to look like that. That doesn't help you with your 10 to 12 break-even problem. Firstly, when you're talking about social distancing, I'm absolutely clear that this is a 1 metre plus approach. This is not a 2 metre issue. You cannot operate collective transport on a 2 metre basis. And certainly the guidance from government has made that clear as well. But that probably still won't give you a 10 to 12, even on a 16-seater. I would be minded to identify the particular seats that are going to be available, how you're doing that, and go back and discuss with the parent group about the risk issues here, because they are your customer and they need to participate in risk management in this process. And if actually that ends up with you needing to do double runs or schedule things differently, or even get in a different minibus, then you're going to have to share that issue with them. And that may well mean additional costs, but of course the costs are additional because you're offering a different service. On the costs issue, Bill, in principle, one can ask for costs in that way and potentially ask for donations. I think there's an issue which Sara would comment on in terms of the benefit you might get from it and what this does for your sort of your long-term image.
Okay, one more from the chat today. So this was is it Jason Donaghy asked a question about what happens if CT ceases to exist. So Jason, can you put your hand up if you want to come in? Just while he's doing that, if people don't mind, I might run on for 5 or so minutes. If you're able to stay, that's great. Just to get a few more questions in. So Jason, your question, please.
Yeah. Hello, can you hear me?
Yes.
Yeah. Thanks, Bill. I suppose it's obviously been a discussion here for us in Northern Ireland through the managers group. I actually think we're quite, as well as it being a threat, there's an amazing opportunity right now for community transport. And I think particularly within our own context, when we look at TransLink and the like, and I think one of the things that we really do need to get to grips with is to really start to demonstrate the absolute value, well, as true and full of value of community transport and the cost savings. So I was talking to the chief executive of our local health trust yesterday, and making that case that, you know, we play as big a part in keeping people out of hospital as many of the services that the health providers do themselves. And I guess that, you know, the question is, if we were to scenario plan and look at, well, let's say community transport ceases to exist, what is the cost in terms of health, economy, all those different things? And in fact, I suppose I would see at the minute that, if anything, we're getting a lot more requests to support and assist social services and others who they can't meet the capacity in their vehicles, and they're looking to community transport to see, can we help them lift their additional need? So I suppose what I'm saying is I see incredible threats, but I also see incredible opportunities right now. But I do think the cost, you know, we've talked about social value, we've talked about value in CT. I think in order to get our case across and to look at a reconfiguration and a more integrated system, we really need to get a better handle on the true value of community transport as we move forward. Sorry, I hope that makes sense.
Yeah. Sara, I'm going to punt this one to you. So I think a question really, as you've heard, around, well, you know, it does kind of showing what the cost of the absence of something might be help in any of the things you've been advising us to do.
Yeah, well, a great point. I think there's absolutely something there around the social cost or the cost to the public purse further down the line if some of this stuff doesn't happen. Obviously, that can be something that's very hard to quantify, if not kind of impossible. But there are, you know, there's all kinds of kind of work that can be done, I guess, you know, whether that's kind of through academic partnerships and research, or just by looking at what kind of figures are in the public domain. It takes a bit of number crunching, but I certainly think even if you can't quantify I'll put a number to it, it is always worth talking about what a world would look like without this, as kind of part of your stories. And there's lots of different ways you can weave that into the way you tell your stories, whether through direct quotes, you know, when you're talking about, when you're talking to users and volunteers, more users, you can get them, you know, ask them what life would be like if they, you know, you will know this, you will all be hearing this stuff all the time, but if you can find a way of articulating that in the way you tell your stories, I think that's an incredibly powerful message, because it shows what wouldn't be there. And I've seen some interesting stuff in the chat as well about things like cost to the public purse of missed health appointments, for example, you know, the type of thing that would happen in a lot of cases if there was no CT or community transport solution to get people to health appointments. So yeah, I think that's a really, really good point, and articulating that as part of your wider storytelling is really important, I think.
Brilliant. Thank you, Sara. So in terms of the questions that are left, we will be able to write back to everyone with these. Obviously, some of them quite technical questions, some are sharing some ideas that you've asked for our thoughts on. So there's, looking through them, there's a few around health. And as we've said, we see this as a place where CTA can do more and be recognised and rewarded for that. And Gavin from Cambridgeshire has raised a very good point about, you know, working with those NHS volunteers to get them with their local CT scheme. And that's exactly the conversation I've been having with them. We've had a couple of points around something we've written to members about over the last couple of weeks around DVSA and its statement that it intends to issue new guidance. We don't agree with what they're trying to do and telling them that. We think they should have read the court judgment from the judicial review in December, which clearly says you cannot conclude in a simple and rather crude way that anyone driving for community transport must be considered commercial. So yeah, we will come back to you about that. So one final question I'm going to ask to both of our panelists is, what is something you've seen or experienced during lockdown that you think we should keep hold of? And John, would you like to go first? Put your mic on, John. Oh, I can do it.
There's been a lot. Oh, I'm still muted.
No, I've unmuted you.
Oh, good. I have been really impressed by the volunteers who have, without question, you know, they have assumed that they were going to be part of the solution, not, you know, sit back and worry about it. So they instantly stepped up to the plate, and that just the net effect for the whole organisation was that it just reinforced the view, you know, commitment that we were doing the right thing.
Brilliant, thank you, John. And Sara, have you got anything from lockdown that you'd like to keep?
Yes, I think the change of pace of life and the way we work. So I think, you know, this idea that people should be on, you know, transport at peak times, getting to offices for kind of 9 to 5. Hopefully that's gone forever, and we've all been thinking a bit more about how we travel, and also how we work and how we kind of work that around our lives. You know, it hasn't been without its stresses, but I certainly feel conversely kind of actually more relaxed. I'm spending more time in nature and spending more time outside, more time in my local community, shopping locally, and also I've got to know my neighbours for the first time. So I think there's been plenty in lockdown that I'd like to keep hold of. Yeah.
Excellent. Thank you, Sara. Well, thank you to our panellists. Thank you to our team who've helped organise today, and to our audience. I think we've seen some excellent chat. Seen a real thirst for more of these kinds of things, and that's great, because that's what we plan to do. Sorry we've not been able to answer every question today, but we will answer them and we'll share them widely. We'll share the presentations. If there's things that have been mentioned in the chat that we've said to come back to, staff are looking at that. So yeah, I think it only falls to me to then say thank you once again to everyone. Enjoy the rest of your Friday and have a good weekend, and we'll see you all soon.